Okay, next shoulder exercise is called table slides, and we do this in a seated position right up against the table here. And you can see how she's got the injured arm right up here on the table, and we have it on a towel here that will allow her to slide the arm nice and easy across whatever surface that you're using. You can either do this in a regular chair or a rolling type of stool. Both are acceptable. So you're going to start in this position here. You're going to get to this position by using the other arm to support the injured arm, and that uninjured arm is going to lift the injured side and place it gently onto the table, and then you're going to place the hand right there on that. And then what you do is you take this other hand, you keep it right on the hand of the injured side, and then what she's going to do is just lean forward, and she's going to use the uninjured arm to help push that shoulder up just like that. And she's going to lean as far forward as she can. Now you might only be able to get halfway down or so. You want to do it till you feel a stretch. You don't want to push through a lot of pain, but just till you feel a nice stretch in the shoulder, and then you're going to hold it. If you can go a little bit further, you're going to lean as far forward as you can, just like that, and just really start to loosen that shoulder up. Now lean back up for a second. Now to get more stretch in the shoulder, what we can do is we'll slide the chair a little bit further back, and then we can lean forward. And sometimes it's a little easier if you kind of hold your head down and then you just lean forward, and you can see she's pushing, helping push this arm forward with his other hand, so we're not using the shoulder muscles, we're pushing with this arm and we're leaning forward, and that's helping to stretch that shoulder out. These next set of shoulder stretches that we're going to do are similar to the ones with standing with the pole, but we can do these lying on our back, and sometimes it's more comfortable for patients who have just had surgery to do stretches like this. So same position, we'll use her right shoulder as the injured arm and then the left side as the uninjured arm. And so just holding the pole like this, she's going to use the uninjured side just to stretch the injured shoulder overhead, just like that. Stretch it out and hold it. Now, you might not be able to get your arm all the way up that way right away, but it's just a slow, methodical process, slowly stretching the arm out with the goal to get our motion equal to the other side. And so if you can only get to right here, that's fine. Hold, feel the stretch, and then you can bring it back down like that and rest. And then see if you can go up a little bit further and push that arm up overhead and get it as far as you can. Okay. All right, we're still working on our shoulder stretches. This one we're doing lying flat on our back. Sometimes this is a more comfortable position in people who've just had surgery. We're going to use the uninjured side, which is her left arm in this case, and the injured arm is the right arm. And so we're going to grab around the wrist, and we're going to use that uninjured side to pull that shoulder up into a stretched position. And she's going to get that as far up as she can, and with the goal to get that stretched out all the way overhead. And if you notice, you see how her arm rotates as she does this. And so with our pole stretch, you can relax right here. We were really just going straight up like this. But if we stretch the arm up overhead like this, go ahead and grab right there, we bring it up, you can see how that arm begins to rotate out to the side. It starts to stretch that arm out rotation-wise in addition to stretching overhead. And so you can hold that. You're really using this arm to help stretch this arm up overhead. Try not to use the muscles on this side. And then you're going to hold that, and then you can just come right back down to the starting position. So again, stretching the shoulder out, different variation from the standing position, lying flat to help out with any postoperative pain. Again, we're going to keep the elbow tucked in at the side. We're going to do external rotation. She's got the uninjured arm here on the pole. The injured arm is right here. And while keeping that elbow tucked in, she's going to push that arm out to the side like that. And that really is going to start stretching out an external rotation. You're going to hold that, and then you're going to bring the arm back. She's going to pull with this side, pulling the arm back in this direction, and then we're going to begin again. She's going to push, and then she's going to pull on the pole, pulling this arm back to the starting position. Okay? Now, the next stretch that we're going to do, she's going to hold the pole either like this or like this, whichever's more comfortable, and then she's going to push the arm up like this, so push your elbow out away from your body with that pole. And then she's going to push it down and rotate the arm at that position as well. Just like that. And so that helps bring the arm up into a stretch, what we call an abducted position, but also an externally rotated position, which helps stretch the shoulder in a more functional way, in an overhead rotated out position like that. And so she's going to bring it back down. She's really just rotating about 90 degrees, pushing. All the motion's coming through the pole and through the uninjured side, and then she's going to pull this back down. Sometimes it's more comfortable if you rotate your hand around the other way, just like that. And so she'll come back to the side. Pull your arm back into the side just like that. And then she can stretch out to the side again, push the arm out this way, keeping the elbow tucked in. And then she's going to pull back like that. Keep going as far as you can. And then after you do those for a while, you can push the arm out. So push the elbow out away from the body. And then she's going to push the arm and into an externally rotated position like that, just to get that shoulder stretched out really well. Good.